Hello everyone! We have now seen what academic motivation is, the different quality types of motivation, and the relevance for a learning environment. Now in this video, we will be looking at different outcomes of motivation and different determinants, paying special attention to the role of basic psychological needs in promoting high quality of motivation. By now, it should not come as a surprise to you if I say that motivation leads to important affective, cognitive, and behavioral educational outcomes. What is interesting is that the literature shows that the different quality types of motivation lead to different outcomes. When autonomous motivation predominates, this has been associated with positive educational outcomes, which then decrease as control motivation predominates and become negative as amotivation increases. So, what happens then when autonomous motivation predominates as reasons to engage in academic activities? And this is a summary of hundreds of studies from general education on the associations and effects of autonomous and intrinsic motivation and educational outcomes. Research shows that when students act mainly out of autonomous motivation, creativity and persistence increases, willing to devote more time to difficult tasks. Problem-solving skills increase as well as academic performance. Students experience positive over negative emotions. And something that is really important is that it's been associated with psychological well-being. In this systematic review, we reported several outcomes and determinants of autonomous motivation, specifically in health professions education. If you would like to read this paper, please find the link below this video. Let's first see the outcomes, which were divided into affective, cognitive, and behavioral ones. With regards to affective outcomes, the literature reports that autonomous motivation has been positively associated with students' academic self-concept, adaptation to university, harmonious passion, which is the contrary of obsessive passion, and positive over negative emotions, and has been negatively associated with burnout, depression and anxiety, and stress levels. The less studied outcome is the cognitive aspect, where studies have reported a positive association with reflective skills and psychosocial beliefs, favoring a patient-centered focus. Concerning now behavioral outcomes, autonomous motivation has been positively associated with academic engagement, attendance, intention to continue studies, academic performance, engagement in peer tutoring activities, and the learning orientation on deep over surface motives and strategies, and the meaning over a reproductive orientation to learning. One particular relevant aspect to our context is that students' autonomous motivation has been positively associated with an approach to support their patients' autonomy towards their healthcare. Let's see a few studies on their results. This here is a study from the Netherlands with 464 medical students from year 2 to year 6. The authors conducted an observational study with structured equation modeling, which is basically a model composed by a series of regressions. Please see the upper path, where autonomous motivation positively predicts good study strategies and subsequently positive academic performance. The second observational study comes from Brazil, also with medical students, in this case 297 first-year students, where we can see that as motivation becomes more self-determined, there is a stronger association with reflection in learning and a meaning orientation to learn, and the opposite was reported with regards to a reproductive orientation. It is also interesting that the authors conducted a cluster analysis, grouping students according to their motivation types, from the ones in which autonomous motivation predominates to the ones where control motivation and amotivation predominate. We can see that the first groups in which autonomous motivation predominates were associated with more participation in tutoring activity. In this third study conducted in Chile, with 289 dental students from year 1 to year 6, we can see in this structural equation model that autonomous motivation positively predicted students' self-esteem and deep study strategies, and negatively predicted surface study strategies. The contrary results can be seen for the association between amotivation and these affectives and behavioral outcomes. Within this motivational model, we can also see that deep study strategies positively predicted academic performance, while surface study strategies showed a negative association. The whole model here was controlled for year of study and gender. All these studies show us how relevant it is for our learning environments to support students' autonomous motivation. So let's turn now to what determines motivation. And here, SDT postulates that we, as human beings, irrespective of our context or culture, do have a tendency towards growth and curiosity. However, different factors from the environment, the learning environment in our case, will support or diminish this tendency. From the same systematic review, we can see that several academic conditions have been positively associated with autonomous motivation, such as enjoying learning at university, attendance, and actually being able to understand lectures. Also, a qualitative method of selection, receiving constructive and informative feedback, and learning in an environment that supports students' autonomy and basic psychological needs. For example, in this longitudinal study that we conducted with dental students in their transition between their preclinical and clinical year, we found that their autonomous motivation significantly increased, but interestingly, their amotivation also increased.
That makes no sense at all.
Yes, this may seem contradictory at first, but remember that different types of motivation do coexist within an individual. And as much as this transition interested students, and they did value what was coming ahead, they might also fear this unknown and challenging territory. So one of the conclusions here was that this transition, that was quite abrupt in this dental school, should be much more smoother, and students would benefit from an early and gradual patient contact, so to increase their autonomous motivation and decrease their amotivation. So then how do we explain these different determinants being associated and influencing students' motivation? What characteristics should the learning environment offer in order to promote internalization of reasons to act and a stable autonomous motivation? SDT postulates that if students feel that their basic psychological needs of autonomy, competence, and relatedness are being satisfied by the different factors from the learning environment, then autonomous motivation will predominate.
Fine, I'll bite. What the hell are you talking about?
Okay, so let's think about these basic psychological needs as nutrients at a psychological level, like our physiological needs of water, air, and food. Therefore, different factors from the learning environment do not have a direct influence in motivation. It is how these factors are perceived by students to satisfy these basic psychological needs that has an impact on their motivation. Let's briefly see what these basic psychological needs refer to. So first we have autonomy, and this refers to making decisions by ourselves, based on needs and values. So you accept and concur with proposed activities. There is a sense of volition and choice, and the sense of ownership. In this context, autonomy does not refer to independence or individualism, as you can be autonomous on your own or in group work, as long as you concur with the proposed activities or decisions. Now, competence, or also referred to as self-efficacy, refers to students' perception of their personal capacity, confidence, and effectiveness. It is not the competence per se, but how competent they perceive themselves to successfully accomplish certain activity. And this is closely related to being presented with appropriate challenges, neither too easy nor too difficult. And it is also related to appropriate feedback and structure provided. And finally, there is relatedness, which refers to feeling accepted and valued by others. It's a sense of belongingness and connection, and this may be towards peers, teachers, but also patients and other healthcare workers in your learning setting. So let me show you this study that we conducted with dental students from year 1 to year 6, where we explore the mediating role of basic psychological needs in the association between a positive and autonomy supportive learning climate and quantity and quality of feedback on autonomous motivation. In these first two models, we can see that both regression paths positively and significantly predicted autonomous motivation. However, when we introduce the mediator variable, the basic psychological needs, into the model, we can see that both upper paths are positive and significant. But now the direct effect has become non-significant on one side and weaker on the other, which then confirms the mediating role of basic psychological needs in these models. So one aspect that I would like you to take with you from this video is that autonomous motivation and control motivation are likely to coexist within an individual, and we can see them as opposing forces. However, as we create a learning environment that supports students' basic psychological need by, for instance, planning and delivering activities and assessment, teaching and relating to students having these basic psychological needs in mind, then the autonomous motivation force should become stronger than the control motivation one, with the associate benefits in educational outcomes. As we do this, we will create a stable motivation for our students. However, if these needs or some of these needs are frequently not considered, then the motivation will become unstable and the structure is much more likely to collapse. So in this video, we have seen that different quality types of motivation lead to different types of outcomes. And we have also seen that different determinants may influence over motivation. However, we should always have in mind that these determinants are mediated by how students perceive them satisfying their basic psychological needs. If we have this in mind, then we will facilitate learning environments that promote internalization and autonomous over control motivation. In the next video, we will be going through a number of recommendations that may be applicable to your educational role in order to promote learning environments that satisfy students' basic psychological needs. Thank you.